Hi, I'm Gary with Tennesseans, and welcome to our COVID dashboard. All right, here we want to look at our hospital capacity chart. So let's go there and scroll down and take a look at this chart. It represents overall hospital capacity in Tennessee. This top line is total number of inpatient beds, which also you can call staffed beds, the amount of staff available to handle inpatients. The second lighter blue line is the amount of inpatients in hospitals in Tennessee. And then the bottom in the yellow is the amount of patients that are in the hospital and have tested positive for COVID-19. It's worth noting something, however, on this hospitalization number. Please understand that when you look at the number of people hospitalized for COVID-19, that number represents people who went to the hospital explicitly for symptoms related to COVID-19 and tested positive for COVID-19. But that number also represents people who went to the hospital under completely different circumstances. They could be in the hospital for heart disease. They can be in the hospital for diabetes. They can be in the hospital for a broken arm. They could be in the hospital for a whole host of varying illnesses and situations. But while they're being hospitalized, more than likely they'll get a test for COVID-19. And if they test positive for COVID-19 while they're in the hospital, no matter what they came to the hospital for, that is now a COVID-19 hospitalization. I can't say what percentage of the number of hospitalizations being represented has that caveat added to it, but that's important to note that this number includes people who are in the hospital for something completely different, but tested positive for COVID while in the hospital. Okay, that said, what you're looking at on this chart, the simple takeaway is this. You can see clearly that as the number of inpatients increases in our Tennessee hospitals, the amount of our overall hospital capacity, our staffed inpatient beds, increases. Why is that? Because hospitals don't staff and pay for more quote unquote hospital than they need to. It's a business. Why spend money needlessly? So it looks like capacity always hovers around 75 to 80%. No more, no less. And as the need for capacity increases, hospital capacity increases. And you can see at no point in time since July has Tennessee hospitals ever come anywhere remotely close to maxing out overall hospital capacity. And that's just important to understand. We've always had an extra of roughly 20%. That doesn't translate exactly from county to county and perhaps in smaller rural hospitals. But in a general sense, what we're showing you in this chart is that we do not, apparently, as far as I can see, have a hospital crisis and shortage here in the state of Tennessee. Our capacity is staying well above what is necessary to keep that 75 to 80% inpatient mark. Another important takeaway from this chart is to see this yellow line, which is the number of patients in the hospital with COVID. That number began to gradually increase in October and has sort of plateaued here in mid-December. In other words, as hospitalizations have been increasing due to COVID, we've now sort of hit a plateau. We're not seeing a rate of increase in hospitalizations anymore. And it's interesting to note that this trend line for hospitalizations directly matches the trend line we showed you before on our testing data of the percent positives. So as percent positives, which means the higher percent positives, the more people in the population are testing positive and getting sick, that percent positive trend line trends directly with the number of hospitalizations. And you can mark that towards the beginning of October. And you can see that as percent positives have trended flat in December, the same thing has happened with hospitalization. So just an important metric and something to look at. Thanks for coming back to our dashboard. Please continue to come back as we help you know the truth about COVID data.